Hey, what's going on, everybody? Today it is March 20th, 2020, and I'm in St. Paul, Minnesota, downtown. Behind me is the St. Paul Hotel. Anybody that knows this area knows that typically there is a lot of people roaming around the park here, and there's nobody. There's nothing. There's still some cars out. Public transport is still going. I saw a few people that were at the bus stops. You know, they're doing their thing. They've got to get to work. But this is just wild. I guess it's what to be expected when everybody's preparing for the inevitable. Anybody that's been following the news, you can see for a couple of days now, it's just been unbelievable what's happening in Italy, and the projections that are coming out of Iran are disturbing, to say the least. Not to get too high on a soapbox here, but I just wanted to discuss something that I think is extremely concerning for Minnesota specifically, but also for all the other cities that had students that they just sent home from school. So yesterday, if you haven't checked it out, I just did another video of Minneapolis. Stopped by the University of Minnesota, and I was fortunate enough to catch a couple of girls, students that were walking, and kept social distance, but I was able to ask them a few questions. One of the things that they said was that everybody left for spring break and then they never came back. And that got me thinking of the tens of thousands of students that went on spring break. I know a number of folks that went to locations that were not home for their spring break, and they were very likely on beaches in large groups of people, and then they went back to their houses, likely with their parents, and that is concerning. So the more I think about it, I'd suggest just pay attention in the next 2 weeks. Really, in a week from now, or from like this last weekend, I can imagine in Minnesota we're going to start seeing a surge, and in 2 weeks from now it's going to get a little scary. And the same thing, I was going to share this with in regards to the UK, is they had the Stereophonics concert, and it lasted for 3 days, and there was tens of thousands of people crammed into a stadium, and now this was last weekend. So keep an eye on the UK. The math doesn't lie, and if you look at all the other communities and everything that's been going on, the math is showing what we can anticipate, and I think people are starting to recognize it. I mean, it was forced upon them for the government basically saying, listen, stay home. But do your own social experiment. Pay attention to the infection and death rates that are going to be coming out of the UK here starting Sunday. And really, I think they're going to start trending upward at a very scary rate. And I don't even know that there's anything that they can do at this point. Decisions were made to let that stuff take place, and tens of thousands of people were crammed into a small stadium and then spread out all over the UK. It was a big concert. I hope they had fun. We're about to find out what the fallout of that is. For those of you that are, doing your self-isolation and staying out of large crowds, trying to avoid, going out unless it's necessary, kudos to you. I'm doing this as part of my job, and it's Coronavirus Diaries. We're documenting the natural progression of things, and it's pretty obvious the economy is going to feel this. And if anybody isn't from a big city, I don't know what else more you need to see other than the Twin Cities, the downtown metropolitan areas, literally ghost towns, aside from a few people moving around. And you can see when people are walking down the sidewalk and they'll cross the street. There's a psychological element that's going on here. And to that point, I will say this. Soon I'm going to have a friend on that is a doctor in psychology. I've had him on a number of shows, that platforms that I run on my own, not for work, to talk about psychology and mindset and that stuff. But he's volunteered to come on Coronavirus Diaries, and I'm supposed to be sitting down with him soon, later this evening, to discuss a lot of stuff that's going on and just kind of some tricks. So if you're into that kind of stuff, you like psychology, check it out. Yesterday's video, I had mentioned I was going to meet with a healthcare provider at a big hospital in central Minnesota. Unfortunately, they're very sick. I can't confirm that they have COVID-19. All indicators are suggesting yes, based on their symptoms. And what's unfortunate is that they have continually been rejected to get tested. They've requested multiple tests. They were never getting them, and they're in a position now where, you know, I'm trying to get them on the show, but I'm not pushing it. I'm not about to sit and try to get somebody that is in their own tough spot to try to come and tell me about how jacked up the healthcare system is right now. I'm sure we've all got those stories, but if you or somebody you know is a healthcare worker in Minnesota or elsewhere, even overseas, and you're open to jumping on the show and talking with me about this stuff, I'm just looking to see kind of where you guys are at in terms of your own locations, your own preparedness, and getting your own thoughts, as well as anybody else. Check down below. There's going to be a means to get a hold of us. Otherwise, you can reach out directly through this channel. I'm going to bounce around a couple more places in the city here in St. Paul, Minnesota, and just look. There isn't a whole lot here, but and then I'm going to get back home, edit up some more videos. I did another interview today with Joe Sabula, who is a physical trainer, and amongst other things, has a number of resources that I think will be really good for folks moving into the coming weeks and months. So with that, you guys stay safe out there, take care, wash your hands, don't touch your face, try to do the social distancing stuff, and if you haven't already, you know, get some stuff in your freezers, get some stuff in your cupboards, because I personally believe that we're going to see more than just a couple week lockdown or a couple weeks of this, and the only reason I say that is math. If you guys haven't checked it out yet, in the links below I'll drop a link on Global Statistics. It's a good site that I've been watching, and it's something I'm going to dig into. There's some linear and logarithmic charts that are showing infection death rates. Hopefully, and here's another thing, if you're a statistician or you work with statistics a lot, I would love to talk to you, because I don't want to send out bad info, but I'm noticing some stuff. I'm noticing some things in terms of linear versus logarithmic scales, and I think that it's important, and I would love for a specialist to come on, share their knowledge with it. I'm going to do the best that I can to address some factors that are going on with the statistics that are deeply concerning, but I don't want to spread bad information or misinformation. So if you or somebody you know understands statistics very well, hit me up. Anyway, there's going to be the information down below or through this channel. Stick around. There's going to be a couple more things, and then I'm headed home. So you guys stay safe out there. Hey y'all, so I just jumped over to another part of St. Paul downtown, and I saw something. We're right by Mears Park, if you guys are familiar. Grocery store back here, man. The line is around the block to get inside, and I'm looking in the window right over here, and it looks like they're doing some sort of rationing or something. They're walking by tables. I don't fully understand what's happening, and I'm not trying to go over and stand in a big group of people, but you don't want to be in these lines, yo. For real though, there's some people that have masks on over there, but I mean, look, they're all stacked in together. Yeah, it's kind of a concerning thing. So different over here. I mean, there's not really a whole lot of people that are doing just park stuff, which is what's going on over here. But again, I mean, you guys can see it right here. Yeah, this is bizarre. I would love to go up and actually ask some of them exactly, why they found themselves in this position. Maybe I just hang around with different people, or maybe I'm just paying attention differently. But I would say at least 3 weeks ago, maybe 4 weeks ago, I kind of had my ducks in a row, I'd say, and at this point, it's more just about staying away from everybody. I'm not even interested in trying to get people to tell me what they're thinking anymore. I have a pretty good idea of what's going on here. So a grocery store with a line around the block, downtown St. Paul. Yeah, you guys should be ready. If you're not already, you're slipping. And just look at the math, people. I'm gonna go back, I'm gonna get into my house, and I'm gonna edit these videos up. I'm gonna have that interview with my friend who's a doctor in psychology this evening, and he's gonna give some really good tips and pointers on mental health and just how to manage what's about to come. It's coming, believe that. Don't believe me, just believe math. it doesn't lie. So I'm out. You guys stay safe out there.